Welcome everybody to this meeting of London Futurists. I'm going to be hosting a fascinating group of people, each of whom have got interesting questions to raise, comments to make on the subject of should we futurists be learning from the COVID-19 crisis. I'll start by echoing a question that has been asked to me by a member of London Futurists. It echoes something that several people have said. He argues as follows: look, the COVID-19 infection has apparently already peaked in China, and the mortality rate in China is only 1 in half a million. If that's the case, why is the whole world panicking? And if we look at the data, this is from the Worldometer's info site. Very similar information is available from Johns Hopkins and others. This does show that the deaths in China seem to be slowing down, and there was only 13 recorded in the last 24 hours. And indeed, there's only 2.3 people per million dead. And it's leveling off. So if this were to be the case in Britain with 70 million, talking about what? 140 people perhaps dying, which of course is serious, but it's nothing to panic about, is it? Well, let's look at some other countries. Here's the figures from Italy. They're not slowing down by any means, and they've already gone far beyond China in terms of the ratio. There's already 21 people dead per million in Italy, and that curve's rising fast. So it's probably too early to say how these things are going to level off. If we look at the number of other countries, United Kingdom is still early in the loop, as is the United States. How high are these curves going to go? It's unclear. The third one's from South Korea, which perhaps is encouraging. It's not showing an exponential trend. It seems to be under some kind of control. The last one is from Iran, where things are still rising. It's not yet at the rate of Italy, but it's already at 6 deaths per million and could become a lot worse. My first answer is to say it's too early to tell. My second answer is to say is that in the past, pandemics have actually affected the world in waves. This is the deaths per 1,000 from the so-called Spanish flu from June of 1918 up to nearly 12 months later. The first wave was alarming. The second wave was very alarming. So these infections sometimes mutate and sometimes for other reasons go through more than one wave. So it's too early to tell what the mortality rate is of this infection. I'd also say that it's unlikely that every country is going to be as successful and capable as China in enforcing these distancing measures. South Korea has managed something similar, but to what extent that can be replicated is unclear. The mortality rate almost certainly depends on the capacity of the health system. It might be low whilst the health system is in good shape, but as it becomes overrun, it could get much worse. It's not just that people will die. We're starting to see some indications of a disruption of supply chains. Interdependencies on the economy could become severe with effects that are, as we futurists know, to anticipate, difficult to manage. Other reasons for being not panic, but serious. As I noted, the infection might mutate. And stepping back a bit, we futurists aren't just concerned about one particular pandemic. We should be looking at other pandemics. If this is a dress rehearsal for possibly a more serious pandemic, whether it's another pathogen or another non-pathogenic social issues, as the podcaster Adah Parris has said recently, it looks like we are failing the dress rehearsal. That's a reason to be worried. So are we ready for this pathogen running its full course? Are we ready for what may happen next? If we're not ready, how should we be preparing for the future? Not just are we ready for what the extreme risks might come our way from technologies and from the fact that we're in a deeply interconnected world. Are we ready for the profound new opportunities enabled by new tech? I think we're not. I don't think we should be panicking. I don't think we should be hysterical, absolutely not, but we do need clear thinking. We do need to be serious. I'm looking forward to hearing from a number of different panelists, their views. David Doherty, are you ready to share your recommendations?
What I'm going to be talking about is what we can learn really with from the experience of mobile technology. So I started a service in November 2006 that let you message with a doctor and communicate with a doctor from your mobile phone, and allowed a patient to give their history using their mobile phone, a doctor to review that information before calling you back, and then a written report to be given to you subsequent to that, that you could use for your onward care and for further research of the internet and things like that. And then we had a survey questionnaire that would be sent to the patient, and the idea was that we'd learn from every interaction we had. Back then, the idea, we've got a 2,000-year-old model where you go to the doctor, they give you care, treatment, and you meet them in person, and you either go away and recover or you don't. But this is a completely new model. And so it's a real change for medics to get around it. And I've got involved in a lot of education programs to teach people about this. But for the first time, we've had just exceptional demand at the moment. And we've had to stop allowing new patients on board because we've got to keep the service up for those people already registered. The service is now available, so it's being copied now within the NHS, and you can actually use this. A lot of GPs have got this. There's a Prime Minister's Challenge Fund that allowed people to get essentially the same service with their own GP. So that's a great thing. And you can check out this website, engagehealth.uk, and you can see a trial of it and you can see how it's working. And the GP demand for this in the last couple of weeks has just gone through the roof. And I think that's going to be the biggest change. A 2,000-year-old model of healthcare is going to be changed by this. What I learned, this wrong picture I put there, I was just editing that, but Tommy Ahonen, who's this guy that did the 3G business model for Nokia, incredible tech mobile group, he wrote about the Nokia decade in 2009. He called that decade as the Nokia decade, just people weren't appreciating it. And one of the things I thought about that was, absolutely. I mean, this mobile phone had gone all over the world, people had adopted this. And what had happened is I predicted that the next decade would be defined by the convergence of mobile and healthcare. That to people at the time was completely outlandish. That couldn't possibly happen. And actually it has happened. People still today don't realize it's happened. This pandemic is indicative that it has happened, but it hasn't happened in any way, the positive way that I saw it. So what's actually happened is, in a lot of these healthcare things that we do now have converged to the mobile. So a lot of people got reminders to take their medicines. They've got apps that they use with their medicines. They've got doctors that they can interact on their mobile phone. So we're now carrying, things that we can Google our medicines, Google our symptoms, we've all got this capacity now in our hands globally all over the world. So this has happened, but there's been the biggest impact has been on our mental health, and it's been psychological. And medics haven't kept up with it. Essentially, the mobile phone operators and device makers were focused on the 3Gs back in 2010, and they were girls, gambling, and games. So entertainment has become this incredibly powerful thing that's been delivered through the mobile phone. And we've become sexually controlled. Sex has become the culture. People, as a result of that, have become very compliant. They've become very reliant on government and entertainers. They've become education obsessed. And we have now NHS psychiatrists treating porn addiction because it fears calling it what it really is, which is really graphically an addiction to watching runaways with drug addictions being abused. So we have this incredible problem that mobile has created, and we have incredible opportunities to address those through the same technology that has created this very different environment we live in. And I think the biggest indicator that we have just gone through a decade where mobile and healthcare converged is when we consider what's happening to the mental health of people who are receiving news, 24/7 news, telling them about the 2020 Wuhan flu. And this is the world's first pandemic where people, the size of the panic, the massive misinformation is causing people to react completely. Everyone's seen the videos that are now on social media. People storing toilet rolls, queuing around the car parks to get into supermarkets to make sure they're okay, heck the rest of the society. And so we have this enormous problem. We also have people like Dr. Jenny Vaughan, who's talking about the scale of this and her fears in the NHS. I will be burying my colleagues, this lady said on Channel 4 News. It's in the next couple of weeks. That was said on Channel 4 News. Now, I know if I was burying my colleagues, I would be wearing army fatigues and I wouldn't be in the Channel 4 studio. So some people have to start sitting there saying, what's the reality in this? Where are we going? What we're now seeing is some very funny memes being produced on the internet. Now, how to spot someone who watches CNN, and there's this guy walking around with all this paper outfit on. The reaction that people are having to this is extreme, and it's to be expected because they're controlled by the information they're reading. But the problem is we have massive silencing coming in now. The big technology companies who have led to this fear amongst people, this ingrained fear and this over-reliance on information, are now silencing people who are talking about it. So the doctors who are talking about it. And this is a huge informational opportunity. As I showed you with our product, we allow you to give your symptom information and allow that to be reviewed by doctors, but also in a large data set. This can be really key to understanding how this virus is affecting different races of people in different regions of the world with different temperature profiles and stuff like that. And it's really the only way that this can be done. But the problem is we've got these big social media companies and they're in making these internet companies and they're in to halt the rise of people talking in ways that don't fit with the narrative that's being controlled. And that's that's the biggest risk we have coming out of this, that we lose a lot of our capacity to talk, discuss what's happened. We've seen how badly this was managed in China because of exactly that. The original doctor who discovered this is an ophthalmologist, but you can't tell me any of the medical observations he was finding in patients who were early presenting with this. It's interesting because it probably indicates there was some eye-related problem with early patients getting this. And wouldn't it be interesting if the NHS had those on its COVID-19 online questionnaire? It doesn't, So
Final minute, David.
Yeah, 1 moment. So basically, the big thing is to calm down. Everyone to relax. Everyone to understand that documenting what their symptoms are, owning the copy, having access to their own medical record. And being prepared to share it the right way. And I've linked to this. It's a talk by Laurie Beckland, who was a Silicon Valley journalist. Just imagine we treated her cancer like a statistic. Treat me like a statistic. Save my life. Imagine if we treated coronavirus like a statistic, and we had such openness to the data. And when you look at the reservations people have for that, they say, well, you can't do these type of things. But if you look at the cancer charities, experts in sharing personal data, just not in ways that help us better understand cancer care. They've all been fined by the Information Commissioner for their abuse of patient data. Essentially, they were researching people's private wealth while they were dying of cancer, looking at their Facebook friends, finding out who they were and targeting them. This is happening. We need to use this data science in positive ways to better understand evolving disease and evolving threats. And then just looking at what technology play out, a lot of this is happening while 5G. A few years ago, I was saying about 5G and some of the risks of it. People are asking, is 5G safe? What we should be asking, is it weaponizable? We can see that the mobile operators are now offering products to power battery-powered devices in the field from their mobile networks. Is it a good idea to put this technology on the top of every lamppost with this capacity? Not because it's dangerous, but because somebody could control it and take control of it, and with that, weaponize it. And if you look at the symptoms of this, this could be, and a lot of the conspiracy people are losing their minds about this could be a weaponized use of 5G. It's essentially a thing you put in a briefcase, plug into the wall, and it can direct a beam of microwave energy at somebody. And so these are the type of questions we need to be discussing with technology. We've got this incredibly advanced technology. Is it weaponizable? And so that would be my takeaway of where this should be going.
Many thanks, David. Lots to think about. Because you went on a bit more than 7 minutes, I'm not going to take initial questions then. I'll wait for questions for you from the overall group discussion part. The next speaker, Steve Buss, he's going to look at one particular area, which is, well, why aren't we getting faster cures for these treatments? We like to think that we're a highly technological society. We like to think that progress is coming quickly, but we can't cure the common cold. And it looks like we can't do much about the coronavirus for what? 12, 15 months before a vaccine's available. But Steve is a citizen scientist. He's done lots of his own research. And Steve has agreed to share some of his observations and findings. So Steve, when you're ready.
Okay, I'd like to talk today about how I think about COVID-19 lethality risk and how to reduce it on a personal level. So I'm a software engineer, I'm not a health professional, but I've spent more than 10,000 hours over 20 years studying and blogging about inflammation and survival probability at longevity.org. I appreciate this opportunity to kick off a new forum post, a new forum thread I'm going to create at Longevity about COVID-19 to drive this discussion about personal lethality risk reduction. And I'll provide a link to that forum thread in the meetup comments once I post it this weekend. It's been a while since I made a presentation. Can we reduce our personal COVID-19 lethality risk? We can certainly take steps to reduce the risk of infection, but can we do more to reduce risk if we get infected if therapeutics don't yet exist? A key biological variable implicated in lethal COVID-19 has become relatively clear. Can we now leverage knowledge of this variable to reduce our risk if we get infected? What might a strategy for reducing personal risk look like? I've been disappointed that there hasn't been more discussion of what we might do on a personal level to reduce our post-infection risk and maybe even preventative, do something about prevention, right, in terms of prevention. So I thought I'd sketch my thoughts. This is version 0.1 of this presentation and my thoughts about it to get feedback so that I can improve the strategy. But we need to turn to some background and keywords first. COVID-19 is triggered by the SARS-CoV-2 virus. It's a kind of ARDS, that is, it's an acute respiratory distress syndrome disease. Studies demonstrate that an intracellular immune system response called inflammasome activation is a trigger for ARDS lethality. In other words, COVID-19 is, to use a word often used, it's autoimmune driven. And if you read study summaries about this, often toward the end of the article, you'll see that the article says, well, it's, you know, our immune system is doing most of the damage. Recent studies in China show that 2 drugs having positive impact on lethal COVID-19 risk are inflammasome activation modulators. And for me, this is evidence enough to take on the conjecture that the science about ARDS in general is relevant for understanding COVID-19 and taking action to reduce personal COVID-19 lethality risk. Okay, and now for some risk reduction details. This is version 0.1 of my view of intervention techniques. This diagram came to me in December when I was facing a different kind of health crisis about how different kinds of evidence about survival probability and disease were most of the time related to inflammasome activation. And when the COVID-19 crisis began, I looked into it further and saw that the inflammasome complex is at the center of what is lethal for people with COVID-19. So let me, this is a lot to cover. I'm going to be talking about this and learning about this.
Well, Steve, I think we've only got another couple of minutes, so I'd like to ask on this. To what extent would the chief medical officers of various countries produce a similar diagram? Do you think that they are sharing this information as well? Or do you think there's a lot not understood widely?
Right. Well, I think it's absolutely widely understood that the inflammasome complex is at the center of the lethality risk for COVID-19. What I don't think is happening is broad understanding of developments going on with intervention techniques, for example, with oxygen and energy. For example, hyperbaric oxygen therapy has been found to profoundly inhibit inflammasome activation. So has near infrared light. You'll notice drugs are on the left-hand side of the diagram, and that can reduce risk. Chloroquine is being studied in China now, and with some positive effects. On a personal level, though, the techniques with asterisks are the techniques that I'm actively using myself. I think exercise with oxygen therapy, a pretty brand new development, is a profound health transforming technique that does reduce inflammasome activation, and it can be felt. So back to your question, I haven't seen a picture like this anywhere, but I think a picture like this is valuable to think more broadly about the root of the problem for COVID-19 as well as aging in general, because inflammasome activation is at the heart of aging, I think.
Just one more question before we move on to the next speaker. Many people will wonder, can citizen scientists really make a difference here? Or should this research be left to the large academic groups and the various corporations who are involved in healthcare? Or would you recommend that more people take the time to do what you have done and learn much about the science?
I think the scientific literature has both deep and broad knowledge that has not really been integrated and understood by professionals in, quote, establishment medicine. When I go see a doctor, I go in with a page of what I think is happening, and many times I know more about the science than they do.
So many thanks, Steve. What I'm going to do now is ask if anybody in the audience wants to ask or comment on what they've just heard.
Yes, I have one quick question, David, if you can hear me. It's Tony Charnitsky. Steve, have you heard about the latest news from India, where apparently they have succeeded with ritonavir and lopinavir. Ritonavir and lopinavir. Just 2 days ago, apparently they cured patients with that combination of HIV antiviral drug and ritonavir.
I haven't heard of those developments, and I think I take prescription drugs. I think they're great. I also think there are non-small molecule interventions that can make a difference. For myself, I'm interested in the most potent inhibitor of inflammation because I think that's the driver of aging. But I haven't heard of those drugs, no.
I think there's a lot to be investigated. I believe that the community, worldwide community, should be able to investigate lots of options and bring them to attention. I think this is one of our responses to the crisis. There's a global crisis brought about in part by connectivity, viruses spreading more quickly, bad news, as David Doherty was emphasizing, bad news, fake news, foolish rumors, Panicdemics spreading more quickly, but at the same time, we can use the same network to spread things more quickly. We'll come back to this discussion. I want to keep going around the panel, letting more people speak. Tim, I think you've got a slightly different set of recommendations you would like us to hear.
Yeah, let me put it into a bit of context. I'm a bit different from many people in not being a scientist or a technologist here. I look at things from a point of view of political futures or ideological changes that might happen in the future. And this particular contribution comes from a short dialogue between me and David last week, where I put up what I called 6 reforms for the post-coronavirus age. And he added 3, and I'm going to refer to his 3 with his permission, because I think they were interesting as well. So given there's a very short period of time, I'm not putting up a slide, I'm going to say what they are, and I'm going to hope that eventually we will have some kind of discussion of those that are most interesting to people. So the context is, what sort of things are we like? The honest truth is we don't know yet what we're going to learn from this. I tend to fall into the camp of a balanced view that is neither complacent nor panicked, and that we have to learn at each stage about something that's constantly moving. So the 6 suggestions I had were political or ideological or administrative suggestions to take us for discussion, to try to think now about what we need to do, so that when it's over, we're ready for it. The first was that the UN has global compact. What we need is a global compact on free scholarly access to scientific data on diseases and their transmission through a global open access directory.
Tim, by the way, you're hiding your face with the paper.
Oh, I am, sorry. That's the camera. So thank you for pointing that out. So that was the first thought, is to make sure that the information we need is open access at all times. The second is a more national thing, that each nation should have centers for the rapid development of low-cost testing kits for new diseases with temporary state control of fast priority production lines and distribution. Now, the political significance of that is it's a return to some degree of state direction when it comes to critical disease transmission issues. We treat it like we would a national security issue. The third was that we should have tax incentives to support a reserve home working capability wherever possible. In other words, from the very beginning, every corporation has tax incentives to go to Plan B very quickly. Plan A is businesses done by people talking to each other. And there's nothing wrong with that. That's a reasonable way human beings respond. But we should be able to move rapidly to home working under all circumstances. The fourth, and this gets more and more controversial because you can detect not an anti-globalization theme here, but one that wants to modify globalization. In other words, we had a period of nationalism, now we've had a period of globalization, and when it comes to disease transmission, we've shown that globalization has risks. So the fourth was the restoration of national and even regional self-control in essential supply chains. And I do mean essential supply chains. I don't mean, making sure we grow our own avocados. I'm talking about serious things. The fifth is that we have higher investment in techno solutions for national food sustainability, such as vertical farms. This is not a food sustainable crisis, at least not at the moment, but we can imagine food sustainability issues in the future. And I'm going to make one political point, and I tend to be neutral in politics, but I liked in the budget the degree to which this government was finally turning to spending money on research and development. And I'm hoping that research and development would be geared to national sustainabilities in a global context, where we also assist other countries that are poorer than us. Finally, and this is the most controversial of all, before I get on to David's 3, is the enabling of what I call instant high energy temporary national and state border controls, fire breaks that permit movement of goods and services, but not people. In other words, in many ways, you could see the rapid spread in Europe being because the ideology of freedom of movement meant that the diseases in North Italy spread very rapidly into Croatia, Slovenia, Spain, then into Germany and France, and they ended up having 3 times our rate. And my theory is that in many ways, nation states are natural fire breaks when you get to existential issues, which I know David doesn't necessarily agree with me at all on, but it's a debate that needs to be had as a modification of globalization while we continue to ensure the free movement of goods and services as much as possible. If I may move on to David's three, which I thought were even though I disagreed with two of them to a degree, is that he made the point that whatever future changes happen with the NHS, we must avoid adverse incentives that deter people from coming forward for testing. I think to some extent the government's already moved in that direction, and the American government has been shamed into moving into that direction, but somehow we have to build that into our systems. We have to look at our social care, our social security, and if you might call it quasi-socialism. It's not true socialism, but it's really a recognition that there are lots of workers in the gig economy or who are in unstable employment who need our protection as a society. David came up with another one, that whistleblowers should feel protected. I'm going to say I disagreed with this one, because I think David was, and he can speak for himself in a moment, was thinking of the importance in China of whistleblowers at certain points. But I hold to a position that says whistleblowers can also be destabilizing in a constantly evolving situation. And there is the problem of political activists inserting themselves into the process for partisan or activist advantage. And again, in China, we saw a bit of that with radical liberals who were linked to the Hong Kong debate, moving in very fast to try to dismantle the narrative of the Chinese state in ways that actually could be potentially very destabilizing in terms of trust in the data that was coming from China, when the WHO was very clear that actually the Chinese were, in general, being clear about what was happening in terms of scientific information. And if you haven't seen it, there's an exceptional WHO report on the Chinese situation, which is worth getting hold of. Finally, and this is where I disagreed most with David, and I think it's always good to disagree because that's how you get debate. David, and I hope I haven't misrepresented you so far, David.
You're doing fine. And by the way, I've taken the liberty of copying some of this into the chat window as well.
Oh, excellent. I was going to put mine quietly.
Who fascinated by some of your earlier points and weren't concentrating perhaps on the next points can see a useful...
Yeah. I am moving a bit rapidly. I appreciate that. I was going to write them up a bit later so that they were, but if you're doing that, that's fantastic. Let me get to the contentious one. And it's actually a very, very interesting point that David was making. It's a theory of, it is about contagion. I think he should speak to it himself at the next stage, but it is the idea that we are in this situation of highly connected networks and that contagion is an issue throughout all networks. And that therefore we should take similar radical views to all forms of contagion that we do with disease transmission. And the only reason I'm going to disagree is because I think it's almost a philosophical point, is that as a ex-politician, if you like, and somebody who's involved in politics and ideology, I draw a big distinction between contagion, which is between us as a species and either another species or a material situation, and contagion that takes place between other people within our species. And the two require very, very different systems and or approaches. And one of the problems that often scientists and technologists make, or engineers make, is to confuse the two systems. That essentially, if we're trying to control existential risk from disease spread in particular, then we need to think in ways that relate to that problem, and then treat social problems, contagious social problems, like, for example, the one that was raised right at the very beginning of this session, which was spread of misinformation. Then we need a different way of dealing with it, because you have lots of different competing minds trying to handle that. A virus has no mind. And I think that's essential to understand. It is our enemy precisely because it doesn't have a mind. It just simply is what it is. That's a very complex philosophical point, and I'll leave that because I don't think we want to go down that route. But I hope I haven't exceeded my time, and I hand this over back to the chairman.
Well, I think there's lots to discuss there.
Too much back.
It nicely builds on the points that were raised by the previous speakers in terms of the connectivity. To what extent do we need to give up on some of the ideals of connectivity? To what extent should we be quicker to impose national borders again? To what extent should we be re-examining other types of contagion, whether it's financial contagion or malware contagion? I'm open for a couple of comments from other people who haven't spoken yet, who wish to maybe dig into some of these points before we move on to the next panelists.
Well, I'll gladly take the floor if you like. For
A bit louder.
2 minutes, if I may, or some. If
quickly, yes.
Yeah. Directed to Tim. I think this is a great opportunity. You may be surprised. I'm really pleased that something like this happened. Because look, this is the planet in a kind of a micro danger. And this is preparing us for real threats that there will be plenty. And unfortunately, we are unrealistic if we deny that such risk, existential risk, may happen. So this is a nice drill, and it shows how the countries behave, react, what democracy means, what autocracy means, what kind of sacrifices we must make to save life, and Tim was talking about it a bit. So from that point of view, looking forward to 10, 20 years ahead, this is fantastic. And we should learn our lesson, because now the government is naked. We can see it with our own eyes, how our government has behaved. This is absolutely preposterous, if I may find a point, because it shows the difference in reaction between the European government and our government. In the European governments usually have coalitions, and therefore within the coalition you have to disclose all your cards. Here, they don't have to. We should have the national unity government, because the crisis is of such proportions. So that is my case.
Okay, thank you, Tony. So you're saying it's we should all welcome this as a wake-up call. I think most of us will agree with that, but what the lesson of the wake-up call is, we probably won't yet agree. Tim?
Just briefly to respond to that, I think those are very wise words, and I concur entirely. I think that in many ways, one thing we're going to have to face is that while we must have a democracy and while we must have democratic change, radical democratic change is necessary, we always need strong government, and we need strong government for these crises. And when we have weak government, a coalitional government, there's a worry that we will perhaps not achieve our ends. And as to national government, if you observe the relationship between Matt Hancock and John Ashworth, on this issue, de facto, we do actually, although it's a Tory government running it, and Hancock is constantly consulting with John Ashworth, and Ashworth is constructively critical about workers' rights and information, but he is not challenging the general strategy. And I think that's why we're in a healthy position compared to some other countries. Thank you.
I disagree entirely, Tim. Sorry. A strong government is not necessarily the government that brings unity. You may be confusing the politics of consensus that is very effective if it has a strong presidential kind of democracy, not like ours. We are just being misled for hundreds of years of believing that the first past the post is the best system in the world because it gives a strong government. It's a fallacy. Sorry.
We'll agree to disagree. We'll agree to disagree.
Okay, next time.
So there are successful parts of strong governments, but also drawbacks to strong governments. I'd like to bring in Adah at this stage. Adah is a cultural strategist and has lots of interesting reflections on how we should react and respond to the crisis and opportunities of the present moment. Over to you, Adah.
So I take a slightly different approach to all of this. I tend to take a slightly philosophical and anthropological approach to technology. So for the last 5 years, I've been looking at our patterns of behavior around the use of technology, in that we have constantly been looking for something bigger than ourselves to connect with ourselves, our environment, and with others. And I see that we have got to a place where we are currently, with this virus, we are currently being affected by something that we cannot see. That is having a profound impact on what it means to be human and how we connect with each other. And I think that a lot of what has been happening, or where I think a lot of our focus should be, on an individual basis, I think that if we start to look at the impact that this is having on us as individuals, it is getting a lot of us to question, what does that mean to be human? What are the impacts that this will have on me? We see a lot of people now starting to self-isolate or being isolated. And what does that mean in terms of human connection? How can we connect with each other? What does that mean in terms of our relationships and how we connect? It's also, if we start to think about how we are looking at our responsibility and sense of community, when we're talking about vaccinations and, cures or some kind of response to this, there's the ethics of all of that I'm quite concerned about in terms of who gets treated first and where does that come from? How do those decisions get made? I have some personal cases where we're already seeing that people who are not seen as being a priority are being told that they can't be tested. And I think that as futurists, these are all these kind of questions that we should be looking at. I think there are experts who will understand the nuances of, and I've been, I'm always learning about and from some of the fellow panelists, learning about some of the insights into what this actually means on quite a technical level. But I think that we can't separate that from the fact that we're human, and this has really been also a question of what does it mean to be human and what is value? And we need to have better systems and structures in place in order to be able to start having those questions and really then step back out and design a different future. I think that we're at a very interesting time where this is a wake-up call. To me, this is a wake-up call for all of us, not just in terms of, futurists and design and future technologies and politics and government, but all of us as individuals, as humans, and to look at what is our responsibility to ourselves and how can we bring all of that back together. I mean, I wanted to keep this quite short in terms of my perspective, because a lot of what I do is around the idea of getting us to think differently, asking questions. And I think that a lot of the value of all of that comes out from having conversations and asking questions.
So Adah, I don't know if you've heard some of the terrible stories from the hospitals in the north of Italy. But got to do exactly what you were saying. They've got to make some very hard choices. Who is it who gets access to the small number of ventilators? When there were fewer people ill, they could treat everybody. Now there are lots of personal agony because they can't treat everybody. So we say that the biggest question is still to think of rules to decide who should be treated, or should we be focusing more on hurrying up with better treatments, hurrying up with creating more ventilators so that we don't have these existential questions to agonize over?
I don't think it's either or, because we can't put lives on hold, and we can't put a stop and say, well, we've got to stop this. I think that it needs to be, everything is connected, and I think that it needs to be a holistic approach to tackling all of this. Yes, we definitely need more ventilators. Yes, we need better policies. Yes, we need faster responses. But at the same time, this is also an opportunity for a lot of us to slow down and take a step back and actually think about what are the important things for us and how can we make a contribution to changing some of this.
So if anybody else would like to raise a question, I'm now suggesting please type an indication in the chat window. I can't see all the 62 screens at once, so if you do have something to raise, let me know there. Gennady Stoilerov, you caught my eye, so maybe you can ask your question now. Introduce who you are for the people who don't know you.
Yes, thank you, David. I appreciate the opportunity. So my name is Gennady Stoilerov II. I'm the chairman of the U.S. Transhumanist Party. We're currently actively deliberating what sort of package of proposals we are going to put forward in response to this COVID-19 epidemic. But one idea that is intriguing and that has worked in China has been the rapid construction of temporary hospitals to accommodate a large influx of patients. And I would like to propose a modification of this idea, which is indeed to rapidly construct such hospitals and temporarily waive all building codes, zoning restrictions, anything that would get in the way, but then also make those hospitals permanent, not temporary, because we need this capacity to deal with future pandemics potentially. But if there isn't a pandemic, the hospitals can be used for research purposes. They can be used to provide superior capacity and quality of care, and combine that with a fast-track program for training new medical practitioners, because the Western world has a shortage of medical practitioners. So I would envision a 3-month training course for first responders, people who don't need to be full-fledged MDs, but who would get taught basic techniques of emergency response so that they can help process patients, especially during a time of rapid influx. I would like to hear all of the panelists' thoughts on these ideas.
Well, maybe we'll hold some of that question until we've heard from one more panelist who's still got to speak. But I do like this recommendation that we should be adopting modern technological options. We futurists have for a couple of years always pointed to the example of the skyscraper that was built quickly in China. In about 57 days, they built this incredible skyscraper. Well, now we've got a better, more up-to-date example. These 2 hospitals that were each built in 10 days. If we really put our minds to it, remarkable things can happen. The other thing that struck me from China is they very quickly repurposed people who had one set of skills into being able to do jobs without having 3 years of training. Of course, they weren't generally capable nurses, but they were able to be nurses for the particular needs of patients with these diseases. So going faster, possibly cutting corners on the normal building codes and other regulations. I think that's something we should be taking seriously as an example. But I'll leave that for the moment, because I do want to hear one more panelist offer his suggestions before we open into that general conversation. Actually, there's lots of good questions coming in the chat window now, so we will come back to them. I do have one more question for Adah myself, which is, Adah, you were talking about it's a chance for all of us to reflect and take a step back and slow down and possibly change what we're doing. Are you able to share something that you actually are considering changing in your own life as a result of this wake-up call?
Yes, so my business has been impacted by the response to coronavirus quite drastically, because for the last year, I suppose most of what I've done has been a public speaker. And so a lot of the events industry has been impacted by that. And what I've seen is that people are rushing to go and produce webinars and online events. And I think that, you know, we had the conversation on the phone, that it's also, for me, it's also looking at how am I bringing the same message out there, and what is the value that people are going to receive from that. So rather than rushing out and thinking that I need to just create something, I'm also thinking about what is the impact that this is having on other people out there. There is a sense of isolation. I'm already seeing that. I know of a few people who have already lost their jobs as a result of this. I have some friends who, one this morning, has said that their family members have the virus. So for me, it's really taking a step back to look at, rather than rushing forward and thinking, right, I need to get out there. It's how can I help to add to or alleviate some of or contribute to some others? And how can I start to address some of the non-technical, the emotional states of well-being of people who are frightened by what's happening and feeling that they are flooded by information, not knowing what's right or wrong. You know, there's a lot of false information and data being out there. How do people distinguish between, you know, how does my 71-year-old mother distinguish between what is right and what is wrong? I'm focusing on how can I help to bring a level of comfort through my work as a futurist to some of that sense of isolation and confusion.
Well, I think you, Adah, are walking a path that many others will be walking shortly too. We know things must change, but we don't want to rush into just making the first change that comes to our mind.
Yeah, I do think it is a time. I do think that it is a time for pause for a lot of us, so that we can actually take a step back and reevaluate what is our contribution to not just the, you know, society and the impact that we want to have, but what is my contribution towards this current pandemic or panicdemic, as somebody referred to.
Thanks. Lots of great questions now in the chat, but before we turn to the general discussion, I'd like to ask Pat Kane, who is the co-initiator of Alternative UK, been around in the political field for quite a while, always interesting ideas. Pat, what's your takeaways and suggestions?
Hi, David. Thanks, everyone. Very, very illuminating and hope-inducing conversation. I'm copying and pasting most of it in the chat stuff, so please contribute there. The Alternative UK is a kind of political platform that aims to sort of address the question of a broken politics, and our slogan is, if politics is broken, what's the alternative? And one of our key stats is that policy and politics is largely forged by the 2%, which is the 2% who are either members of political parties out of the registered voting population, and then the tiny percentage of those who actually formulate policy. So, you know, when it comes to, I haven't been looking very hopefully at how that elite responds, given its narrowness and its narcissism, to a general crisis like this. But, you know, ironies abound. We're particularly interested at the Alternative UK in localization, in the idea that one of the answers to a broken politics is local control, sort of small a social anarchism, federation, usages of technologies to empower communities, etc., etc. It's quite ironic that a few weeks ago we were sort of celebrating the Italian sardines for using the power of public space and public assembly to sort of face down right-wing populism in Italian town squares. Now the very idea of that is terrifying and toxic. And it's just a general acceleration of politics. That's one point to kind of generally notice. But I think one of the things that this particular vector of danger is doing is it's sort of pointing up various fragilities in the current model, and certainly in the current model of social consensus and political economy, which we'll have to do something about, and which certainly from the green end of the futurist movement, people have been predicting some of this for quite a while. I mean, the pandemic possibility has been pointed out by environmentalists for a number of years, looking at the way that agriculture moves into wilder spaces, releases pathogens from these spaces, and then increased globalization and mobility will accelerate ourselves to the next big bug, as the kind of the experts generally call it. So that's been predicted as a consequence of a kind of runaway globalization. We're going to destabilize the biosphere. We're going to mix and match paths of transmission of superbugs such that something terrible and cataclysmic happens. So that's been on the list of predictors, as well as global warming and everything else. But I think the one story that I read, Robert Peston, the political columnist, put up earlier on today, was that one of the things that the government might have to anticipate doing is to really isolating older patients in order to, you know, save them from the bug. There might be an element of social distancing going on amongst people who are already beset by the maladies of loneliness, you might call it. So what's our communal response? Well, obviously, what I immediately thought, well, what a community-based response to this would be digital and network literacy. You know, to be able to go to homes to see if they have the technology, or to find a way to pull the technology and get it in there. Get older people used to the idea of using Skype or Zoom or web technologies, and that's a kind of social action, but which actually, you know, it goes out to where the need actually is. But doesn't depend on the old solidarities of public assembly or of Extinction Rebellion occupying a bridge or whatever. So that strikes me as important. And sort of finally, what this is doing for us as a kind of work-obsessed society. I mean, one of the great macro demands of our kinds of movements is to say we need a shorter working week, and we need a universal basic income, so that we can get more social time, more cognitive time, more creative time into people's lives, in order that we can cope with a complexifying world, and a complexifying world not just in terms of technological singularity, AI, but also complexifying in terms of how we're bumping up against planetary boundaries and the demands of an eco-future. So there's the macro demands. We just had a general election at which some of these ideas were proposed and roundly defeated on the UK level. But look at what's spontaneously happening in our home confinement. We're suddenly realizing, for example, how much time we're spending commuting, how much time we're spending in pointless, phatic conversations with colleagues. We're also finding that we maybe have time to dwell on different kinds of projects spanning out from our domestic space into our community. Now that's one positive outcome of coronavirus, is it's actually getting us to question our social contract and our political economy in ways that the people have been trying to do most of my adult life, all the way since Andre Gortz and Rudolf Barrow and Alvin Toffler in the 70s and 80s. But now people are actually have an experience of what it's like to unplug from business as usual, unplug from presenteeism, and find themselves with a bit more autonomy and space. It's a bit like what happens at Christmas when we get a snowfall and we're all joyfully locked in and then have to kind of figure out what to do with our time. So I think that's a good outcome. And I wonder whether we should be ready in the future, whether it's floods, whether it's vectors of disease, whether it's warming, whether it's fire, whatever it is. I think there's a political opportunity, a futurist political opportunity, to say that this implies that we need to think of the next system. This system is simply inadequate. This managed capitalist system is inadequate. We need something else. And it really requires a wee bit of systemic confidence from advocates to say this is the next system that could maybe cope with this ramifying complexity a lot better. And I think the last thing I would say, I think if I'm one more 30 seconds on this, David, we're working a lot with a concept that comes out of the peer-to-peer movement, which is run by people like Misha Bowen, some of you might know, which is the idea of cosmo-localization. And the idea of cosmo-localization is that you build locally, but you draw your information down from the cosmopolis, from globally, from the cloud. I mean, we're actually literally seeing that happening with our debates about what expertise to believe, whether it's the UK governments or the Chinese governments or the European governments. We actually have enough of a media sphere where we can be active, cognitively active citizens, rather than, as the story we have about social media, emotionally reactive citizens with our buttons being joyfully pressed by Cambridge Analytica and other algorithm and affective manipulators. So the cosmo-local model is something that I think is happening now as a result of crisis and extremis, but it's also a positive model. And I think we might be, if we can think about a post-globalization, which I think Tim was talking about, I think that's a vastly interesting field of models to explore. Lots of relationships between institutions and society and technology and culture and values that we can explore in this post-coronavirus space. And I've heard already some great ideas already from this community, so I'd like to strongly develop those. Thank you.
Many thanks, Pat. And Tim, since you referenced that, do you have any comments?
I think we're in a time of amazing change. And I think we're moving into a new world, and it's too early to tell what that world will be. I come from a very pragmatic political background, which is very resistant to utopian idealism. On the other hand, what Pat was saying was very resonant, extremely resonant. And there's an old Marxist idea of the dialectic, you know, the thesis and the antithesis, and they come together as a synthesis, and this is the new world. And I'm not a Marxist, but it's a very fertile idea. And I think there's a lot to be said for, if you like, the merging of my capitalist critical pragmatism with everything that Pat is saying. My concerns is that there are too many people in this field who are what I call utopian idealists. And Pat made a very good point about the election. At the end of the day, despite all the Extinction Rebellion performance art, despite having a Green Party in place, the radical Green position didn't win votes. And so something needs to be done to merge Pat's world with my world and maybe futurism, maybe the futurist parties, maybe they're part of the way to that. I just got an open mind. I just think it's too early in this grand strategic change for us to make a final view on that. But you know, maybe Pat has a view on that as well. But
well, very briefly, I think it's a real moment for institutional and organizational innovation, and I think that begins to bridge the gap between where you might be coming from the kind of the macro perspective and where the activists are. And I think, you know, we've had sort of 20 years of the internet being, as Clay Shirky would say, an insanely good organizing tool. It's insanely easy to make organizations through the internet. We now have 3D printing and blockchain, which offer, I haven't quite realized it, but they offer to make production and currency a distributed phenomenon. But I think the most important thing in terms of people creating these institutions is we must address what is called the emotional or the affective question, that they call it in neuroscience. There is a level of emotional viscerality behind all of these things. I mean, obviously fear at the moment, but hope comes in too. That we have to be articulate, and so this isn't just for the technologists and the politicians, but it's absolutely for the narrators, the media people, the marketing people, the games people, who can get at people's emotions and find a way to motivate them to be communally, civilizationally bold and brave. So I think that's another thing that bridges where you might be, where I might be, which is a real call out to the creative industries and the marketing industries and the advertising industries. They used to say everybody has a novel in their drawer in the advertising industry. Well, they should be having ways to tell better stories about how to get people motivated for levels of self-determining change. That should be something, the stories that motivate people to that, the kind of It's a Wonderful Life level of intense, powerful, mythic story is what's required to bridge that gap between you know, anger, fear, hope, and very few structures, and the view from the state which you're talking about. I devoutly desire a meshing between the two, but I think the disillusion with contemporary politics is so high that I'm starting where I'm starting from, which is from people who are almost apolitical, if not anti-political. How do you motivate them to become citizens adequate to the moment is a really urgent question for Indra and I in the Alternative UK.
Let's feed in some of the questions that we've got on the chat. When Janati suggested earlier that we should be going faster in some ways, we should be setting aside former restrictions and rules so that we can build hospitals faster, hope they don't fall down. Other people on the chat say, well, what about building a vaccine faster? And Donald Trump is saying there might be a vaccine in a few months. Other people saying, no, you can't do that. The vaccines need to be developed more carefully. People in chat are pointing out that there were, sadly, some cases in the past of vaccines that didn't quite work. And if you vaccinate large numbers of people and even a small number of them have bad effects, then you get what the anti-vaxxers would make a fuss about, rightly in this case, that many people might be more damaged by the vaccine than they would be by whatever we're trying to protect them against. So in this potential new politics of the future and potential new society of the future, where do the panelists sit on questions of checking and testing and building consensus versus experimenting more vigorously and being prepared for things to go wrong? Because if we don't take that kind of risk approach, we're going to be overtaken by circumstances and we're going down the tube. Tim?
Just a very brief thing on the hospitals idea, which is a very good one. In fact, the military are quite capable of building these hospitals a very short notice for their bases. And there was actually a company I came across that was actually commissioned. I can't remember its name, but essentially what it would do is go into a military base and provide a hospital at very short order in somewhere like Afghanistan. And that leads me to a thought that that really we built up these amazing military capabilities, military industrial capabilities, especially in the United States. And there is a process by which those huge capabilities could perhaps be directed towards healthcare in an easy way, not to make them doctors, but to make them the engineers and facilitators of the infrastructure. And I wouldn't be surprised, I don't know this, maybe somebody can correct me, if the PLA was not behind the building of those quick hospitals in China. So this military aspect to it and converting it to civilian use, which is an old left-wing argument going back 40 years, maybe it's the time for that.
So this is not swords into plowshares. This is swords into hospitals and
Yes. Into ventilators.
swords into ventilators. Yes, indeed. Steve, you want to answer?
Yes, you asked a question about the longevity scientific establishment and citizen scientists and knowledge integration, and whether we can count on longevity science scientists to do what we need doing. The fact of the matter is that diagram I showed that showed all these intervention techniques hit the same biological mechanism of action. That was low-hanging scientific study fruit that I integrated. And it's just strange to me that being a software engineer, I could come up with it, but I haven't seen that described in the scientific literature. And I think there's, the focus of these scientists is on doing experiments about particular intervention techniques of their preference vis-a-vis, significant biological objects, but I haven't seen this kind of integrative view. It makes sense to me that a person like me interested in optimizing the interventions would come up with something like this. It would be better if scientists, they would do a better job of integration if there were scientists focusing on it.
Thanks. I want to turn to somebody else in the audience who's got a good background in the pharmaceutical and medical industry, life sciences. Annette. Annette, you've asked various questions on text. You've got your hand raised. Would you like to take the floor?
Yes, I can comment on some of the raised questions. I did spend good 30 years in developing new medicine. Develop a vaccine. To start with, serums of patients who recovered already being injected. That is model of a vaccine. We expect that blood of recovered patients contain antibodies, and we can't isolate them yet, but we can take a portion of the blood and inject to patients. And the Chinese reported that it's actually made a good impact. Live vaccines are shorter to develop, but obviously not every disease would react to live vaccine. Recombinant vaccines is longer to develop because we introduce various impurities, and it's generally some another bacterial cell generating adjusted DNA of large molecules. There are a lot of safety implications if we just start injecting it to people without testing. Depending on what type of vaccine is actually possible to develop, there are not one type of vaccine, there are many of them. So the course of action and the amount of tests and duration of development going to differ. And that's the only reason why. But what's happening when disease like this occurring? Immediately, scientists would start testing available drugs, what's in the market. And we have this, actually, European Commission is supporting a project on mature drugs being repurposed. And I'm sure we will soon hear what available drugs could actually be helpful. And I also want to comment, if I may, on what Steve is raising is the synthetic evaluation of available tools, and including tools which are not necessarily pharmaceuticals. And we have very disbalanced health care system and information about healthcare tools because pharmaceuticals are pushing up. And I don't want to blame pharmaceutical companies to doing a good job. I just want to say tools like oxygen, exercise with oxygen, and all other kind of tools Steve shown in his diagram, they're available, but they don't have driving force behind them. There's no money. And because we're driven by the goods and services being sold, if there is no seller, and there's no buyer, there's no exchange of money. And that's why those very cheap, very easy to actually get tools and services which we can help a patient with, they're not being utilized fully. It's unfortunate, and it's up to healthcare providers and up to us really raise this issue. And it's not just money. There are groups like psychologists, physiotherapists who don't have, or even dentists who don't have very well developed medicine or very well developed tools. They can't introduce that type of services into guidances with NICE, for example. And they always say, oh, we don't have money, but they don't have methodologies, they don't have ideology of developing something or writing those guidances. It's more than just money.
So, Annette, I mean, you mentioned about oxygen treatment. I was reading earlier today some reports on what happened during the so-called Spanish flu outbreak in 1918, 1919, and quite an effective treatment for many people was just to go outside. Patients who were treated outside in fresh air and with sunlight had a better recovery rate than people who were left inside. That's an empirical finding that people had. So maybe there is treatments that won't make companies lots of money. As to how long it may be before we do have good treatments of one sort or another for the COVID. Do we have to expect that we need to wait a year? Or do you think with the right circumstances, with the right government support, we might have suitable treatments much quicker?
No, but treatment regimes made of available medicine, available tools is already in place. We do have recommendations what to do for hospitals. And of course, once new medicine arrives, that would be enhanced. But it's always a combination of treatments, of combination of interventions. So we we have recovered patients, so we have quite effective way of actually treating disease. And I think the disease will be a test to health system. Not just, there are two elements here, how well our epidemiology can actually function and how well the governance can support epidemiologists by closing airports, by banning events. It's all interconnected. That big government and forceful, strong government may be good to help, but it also has to be just technocratic governance, just people who understand what they're doing, and not just politicians who are in offices, but actual technocrats, actual medics and epidemiologists who have access to power tools to enforce it. But another, of course, part of it is just healthcare, simply when people are ill, how we treat them. If we have those guidances to utilize everything we have available, we have oxygen in hospitals. We do have the ventilators and all recovery tools. We might not have enough of them, but again, that's how it's going to be a big test. I heard yesterday some big official in the UK talking down the Chinese system, talking down Russian systems, being concerned that US close entrance to Europeans, but still allow Russians to come. We need to be realistic and understand some system actually functional. And it's not about how much money they have, it's about how well they function. Stop criticizing other countries and other governments, just observe what's happening, learn lessons, and share the best experiences without prejudice. I'm
Absolutely.
Particularly annoyed. Sorry, David, I'm interrupting. There's one thing I want to say. I'm so very annoyed with internet, with Facebook, how much very bad information being spread. There's absolutely no access of scientists to media, in media to scientists. There's a total disconnect of experts reaching public. And I think we just completely overwhelmed by trivia. We have to say war to trivia because we only have 24 hours a day, only 7 days a week, and all of it full of useless information. There's no science in it. There's no knowledge. Only just I can't say, is a very, very upsetting how little public actually having access to good piece of information. It's a governmental failure. It's also, I think it's very important to have science advocates. We have population which is completely not scientifically minded. We have people who are not able to absorb scientific information. It's too long, too boring, too much, and they're just shutting down. They want to have trivia.
Let's move the microphone on. Thanks very much. Eva Pasco has some things she'd like to add to this conversation. Hi.
Hi, everybody. Hi. I'm very intrigued with what Annette is saying, because I can see that from implementation perspective, having strong government, or as was mentioned before, pragmatic government is all amazing. But I can also see how people last week and even this morning are so distrustful of this government. Nobody believes a word they say. Conspiracy theories all over the place because they totally lost the trust on Brexit. So the question is that government will ever be able to rebuild that trust? Because it's not an easy job. And as Annette is saying, that this information is amazing, but it's just confusing everybody. But it is there in the vacuum of trust.
I just don't hold to this distrust of government narrative. I mean, you've got a government with a majority of 80 for a start. Ipsos Mori polling shows that actually most people do trust the government. And the government has, despite Brexit, has at least half the population on side from the very beginning. I mean, what I think is, there is an issue, and that's unity, is that people are still playing old battles from a previous crisis in a current crisis. And I think, you know, even mentioning Brexit in this context is not helpful, because that battle is a very different battle. Now, I did mention that freedom of movement might be a problem, and I hold to that, but it's not, that's not the key issue. The key issue is, does our public health system work? And that's where Jeremy Corbyn has a point, that while we have a very different Tory government now and should be taken on its own merits, for 10 years, an austerity government did underfund. They considerably underfunded the National Health Service. But I don't think that people have no trust in government. I think they just are nonplussed by the crisis and want strong government. And actually, the government so far has acted rather well, in my opinion, anyway.
Pat, did you have a counterpoint?
I think sociologically it would be agreed that the general crisis in professions and occupations that previously have held authority, and that's been accelerated by citizen science, by information networks, etc. But I think when it comes to assessment of journalism, of the fourth estate as a means whereby any conduct, any communication between citizen and government happens, that's extremely poor. I think the idea that things proceed by legal cases brings lawyers and the law into disrepute. And I think we do have a bit of a challenge on re-establishing the level at which we think that things are true and that things are real. And I think there is a crisis there. And I think it may have to, one of the things that, permaculturists might say, or people from the transition towns movement, or even some of the cultures within AXR, is to say that truth is emergent from as many people as possible having access to information and conversations about that information. We're slightly getting that from citizens' assemblies. The appetite for citizens' assemblies is as much an appetite for a culture of slow deliberation and of thoughtfulness and a need and a desire for that, as much as it is to kind of solve the problems that governments can't solve, whether it's over Brexit or abortion or gay marriage or whatever. So I think there is a bit of a crisis of truth and reality, and I think we might need to do some experiments with re-legitimating our belief in gender. So I quite agree with Eva's trust gap, but I think the institutions of it might not be happening at the kind of national macro level. We might need a slow local truth to rebuild the very idea of very belief in truth in the first place.
Eva?
Yes, I think that we're paying a very big price for constant and consistent undermining of experts over the last 4 years. I was shocked when I noticed Boris is now using experts as a shield after mouthing off quite negatively about any sort of expertise for the last 4 years. It's not a different government, it's exactly the same government. So nothing has changed in a week. And I've got kids in 3 schools, and I tell you, people's trust level in the decision of not closing the schools has been about 0. So everybody just pulled the kids out of school anyway. So you're having on the street increasing rumor and increasing conspiracy theories, and nobody wants to be part of the herd immunity experiment. If there are models behind it, they have not been released. If there are stats behind it, they have not been shared. So step by step, the government is making a bigger hole for themselves, and people will have things in their own hands, which could be noticed in my Tesco this morning, which was empty of pasta. So middle class revolution, perhaps, but it's not the way to win hearts and minds.
We've been going for nearly 90 minutes. I want to wind this down soon. I really like the idea of having citizens' assemblies, although nowadays we probably couldn't have a citizens' assemblies unless we're all wearing masks and bumping elbows. Perhaps we need to learn how to do this kind of citizens' assembly better. I'm quite happy with some of this discussion, although it is frustrating that we don't yet know how to have a really good discussion involving 58 people at the same time. We need to figure that out over time. I'd like to bring in people who've been waiting patiently, and then we'll maybe hear closing remarks from some of the panelists. Didier Cournel, you've been studying health for a long time, and you have an interesting political background too that you might want to share. So Didier, are you still here?
Yes, thank you, David. First, thank you for organizing this. Secondly, I would just want also to say that I suppose you mentioned already that there is the Singularity University organizing an event online during 3 days.
Yes, so Singularity University are indeed organising a remarkable set of events over 3 days, which I mentioned in the most recent London Futurist newsletter.
Okay. Yeah, then my point that I want to say now is, well, first, to be honest, I still don't feel if this is a very, very bad situation or if people are overestimating it. But my impression is that at least we are sure that it's not going to kill so many people, and are sure we are at least we are also sure that most death will be old people. One of the reasons that people are so careful today is that it is because life, let's say the life is more precious than it was before. I think that the situation that we have now is because people are more careful for protecting lives, and this is very positive. And so this is also very positive for people like me or like you, David, or like many people here who fight against diseases related to aging and to want more longevity. The only thing that is missing is to have the same kind of priority for progressing that the priority that we have now to fight against new diseases. I hope I was clear. I'm sorry. Sometimes my English is not good, and today is not good enough, maybe. But yeah, that's what I wanted to say.
Many thanks, Didier. Let's have final comments from the panelists on any points that you want to emphasize or things that you want to answer.
I will say that I thank you, first of all, for bringing this conversation together. I think that it's been an interesting one, and my takeaway is that this is a systemic situation, and that we need to look at this from not just a medical perspective, but also a socioeconomic, a political, a very personal perspective. And I think that that's where I'm going to continue to look at it and have more conversations. And if anybody wants to get in touch with me, please feel free to do so.
Thanks, Adah. David, final thoughts?
Yeah, very interesting chat. I think there's lots of different ideas coming from all corners on this, and I think we've got a very outdated healthcare system. The idea of throwing hospitals at a problem like this is really short-term, lacking the sort of vision that you would expect from London Futurists. I think we should be looking at how this becomes normal practice, normal clinical care. For years, I've been talking to doctors who say, why would I want a video call? And now they say, why wouldn't I? Similarly, I've had arguments with doctors in public, online, where they've said, you know, they want to use their printed books. And now they say, take them away from me. Washable phones, washable electronics. This is the biggest format in the UK at the moment, across the world, that these mobile phones are unwashable. I think huge opportunity for electronics companies, technology companies to take away paper from and provide safe ways of having it retained on devices and things like that. So there's huge scope for technology. And then we've got to remember, what if it fails? And this is a great test for the market to see what sort of urban populations can be supported when systems fail. And I think we're going to see that unfold in the next few weeks, and hopefully people won't chuck too much panic on top of it.
So when there is a crisis, things can change more quickly, especially if there have been ideas prepared in advance, such as using mobile technology to conduct the majority of medical consultations.
Yep. And what we're doing here, discussing ideas. You know, some people will say, well, what are these people, why have they got time to be discussing this while we're trying to handle this pandemic? And you've always been live streaming your events, you've always been sharing openly the findings from your work, your publications, and I think more people could be like that, more generously giving away information. The medical profession is terrible at that. You know, these big publishers, they put paywall in front of all their content. This shouldn't be tolerable and won't be in a situation like this. We saw very quickly Russian sites springing up to publish all free access to all papers on COVID, coronaviruses and stuff like that. So there's a positive out of it as well.
Yeah, so well done to the Russians who published that information more quickly. Some of the other groups have done so as well. Let's hope this becomes the new normal. Steve, any final recommendations or thoughts from you based on the discussion so far?
Yes, I was thinking about a fundamental issue related to the speed of knowledge integration and diffusion that exists in the public domain. I have a great example, 30 seconds here. Manfred von Ardenne, born in 1907, invented the TV in Germany. He met Hitler, and his TV sets were used by the Nazis before the war. After the war, after he was captured by the Russians, he was a key team leader to help the Soviets build their atomic weapon. In 1960, he turned his attention to biology and spent 30 years researching and writing about oxygen. He published a book in 1990 called Oxygen Multi-Step Therapy, which is still the Bible for oxygen therapy and its benefits. And we still have not, the medical establishment has still not integrated his insights 30 years after his book was published.
That sounds like an important topic to investigate outside this meeting.
Yes.
Yes, many thanks. Tim, I feel that we haven't really done full justice to the very interesting set of proposals you kicked us off with. Is there something you'd like to echo, raise further here?
No, I have very little to say other than to thank you for a very stimulating opportunity for everybody, I think, on this talk-in. I suppose the only thing I want to say, perhaps, is that we're only at the beginning of this major change. And I feel we need to understand, in my opinion, that we won't make this change. This change is going to make us. All the maybe more utopian and dramatic ideas we may have at the beginning are in danger of diverting ourselves from the process and going with the flow of that change and then creating what we want out of what happens. And that's a complex idea, and it's probably an unfashionable one, but I leave you with that thought.
Slightly fatalist, perhaps. That
not at all. Not at all.
The change will make us. So,
but this is a very positive thing. It's transhumanist in the philosophical rather than the technological sense. It changes us as a species to the next stage. And my personal view is going to bring us back into balance to a much greater degree, so that we, as a species, if you like, are going to relearn some of our sociability without losing our individuality. But we don't know how it's going to happen, and trying to predict that or manage it or manipulate it in advance may not be the best way of actually making the best of it. But that's another big debate.
Well, maybe we should have that debate sometime. Pat, final thoughts from you?
Very briefly, two thoughts at two completely different scales. I'm just going to post up a link article in a place called Climate and Capitalism, and the guy who's written that identifies the most powerful artificial intelligence system we know, which is neoliberalism, as part of the problem here. It's provocative, it's worth a read. So that's at the very macro level scale. How do we deal with this at the very level of the planetary, economic and regulatory technological system? And at the smallest scale, I think we're dealing with a very, possibly extremely traumatized population facing political shock after political shockwave after political shockwave. I think there's a personal commitment for us to be as communitarian as possible at the moment, and to try, if we feel as if we have some mastery of the situation, to put that at social and community service. So I think if there's any networks that you think you can build or strengthen or be part of that simply make people feel as if they are not alone as the world falls down around about their ears, I think that would be a very, very valuable for each one of us powerfully agentic people to think that we could do.
And if people want to find out, Pat, more about the work you're doing with Alternative UK, how can they do that?
Very simple. Type in The Alternative UK to Google, www.thealternative.org.uk, and we are a prototyping and thinking space for the new structures, bottom-up structures appropriate to these challenging times. So we'd love to hear from all of you.
Does anybody else in the 54 people who are still on the call want to get something off their chest at the end of the call, something they feel that ought to be added into the discussion? Paul?
Hi. Hello. Hi, David. Thank you very much for this online meetup. I just want to, I read in the independent.co.uk, it said that the UK chief scientific advisor had said the government wants 60% of the population to catch coronavirus to try and create herd immunity to protect against the virus becoming an annual crisis. I just want to ask the panelists if this is a good idea. Thank you.
Does anybody feel confident enough to answer this difficult question? David?
Yeah, this is very much a veterinary term, so with very little understanding of how we can apply this as humans. You know, it's beyond most people's scope of what they think about in terms of allowing some people to die on the basis that everybody will survive, and that'll be a quicker fix to it. So really people should be looking to veterinary markets for that. They treat things very differently, and I work in the equine market, which is the world's most valuable animal, and all the horses there are chipped and have electronic passports for years. They have a full up-to-date vaccine record, or they're not allowed to be admitted for breeding or for transport or for competition. And so they have a very robust system, which is very well developed. And there was a failure of the equine flu last year, and we saw veterinarians and trainers of horses doing steps which are actually illegal for us to do as human doctors. And that's
So are you urging all of us should be chipped?
No, they couldn't actually do it. So we have laws in place which don't allow you as a GP to monitor a baby's temperature when you're administering a vaccine. So when you question vaccine safety, you become immediately anti-vaccine. And this is a very challenging area. When the equine flu failure in new markets started spreading this, what happened is that they actually started temperature monitoring all the horses. What they do is they started doing temperature monitoring on all the horses twice a day. Very labor intensive process. They now have a chip, which is a thermal monitor that they put on horses. So the vaccine safety goes beyond the vaccine industry in veterinary markets. It's not allowed to in human medicine markets. Parents wouldn't be allowed to. And if you look at things like research kit, what should be happening is as vaccines come in, patients should be using research kit with the vaccine, and that would make an incredibly safe vaccine as it came out. And people would have to understand that feedback is and the vaccine is developing in real time. We can do that in animal markets. We're not allowed to do that. And then also, when you're looking at herd immunity here, you also have to understand that our veterinary controls for producing food should be copied in markets like China, where wet markets are still tolerated today. And this is believed to be the source of this. And it's not surprising when you look at the high standards that we have in food production and things like that. And we can't extract that from human healthcare. The vaccination of small animals, the way our food production is done in the UK. Those farmers should be protected. This is a great opportunity to call for eating of produce produced in the country. So there's loads of stuff there, but you've got to look at this as a One Health angle. You can't regard this as a human healthcare problem in that way.
So sounds like there are some concepts that we're going to have to get more used to. The concept of herd immunity is one that we're not all familiar with. It's a complex concept. It's not something we can instantly assess with our instincts of yuck or wow. We need to take time to get used to it. There probably are other concepts which vets are familiar with, which maybe again our initial reaction is yuck. That shouldn't be applied to us humans. We're different. We're not like that. But perhaps we do need to put some of our instincts on hold temporarily so we can assess things more carefully. Janina, you had a comment on this?
Yes, I mean, I'm not an expert on herd immunity, but it isn't an alien concept to human populations. Essentially, if anything needs communication via a human agent, if enough people in a population, and I believe that this level is deemed to be 60% by various epidemiologists, then it in fact confers immunity for that population. The only alternative is vaccination, of course, but there is actually a sort of natural ability for any population to acquire herd immunity. And it is a sad fact that in the process of doing that, people will die. But I don't think in the context of where we are now, which is the NHS the way that it is, the fact that it's winter and not summer, and all those other factors, I don't think it is irresponsible for any government or any person in authority to drive the car that is the NHS to be better able to actually treat people who need treatment in the realities of the resources that they have. But herd immunity is not just about vaccinations. It's actually about being able for a population to acquire enough immune people so that transmission is not as high as it could be.
I really will draw the conversation to a close here. It's a cliffhanger, so maybe people will be encouraged to tune in again to see what's happening next. We have some concepts that maybe part of the industry, part of the society is used to, but needs to be looked at more widely. I think it's a bit like a fire break. The idea that you would stop a fire by creating a fire initially sounds a bit crazy, but when you think about it, then in some circumstances it might be safer. So I'm really sorry we couldn't come to all the points that were raised. I think we should stop while we're ahead. Thanks to everybody who has stayed throughout the conversation. It is going to be posted online. Hopefully the recordings come out reasonably well. And I will propose to dig in more carefully into one or two areas in future London Futurist online meetings. Thanks to all. I'm going to close the recording here, but I'm going to leave the Zoom meeting running for a bit in case anybody wants to copy things from the chat. The last thing I put in the chat, by the way, is a reference to a book on the rules of contagion, why things spread and why they stop. And the why they stop thing is relevant to the discussion of herd immunity, and not just that we have an exponential curve, but we have a tapering off too. I think we all need to become more familiar with these concepts, and as a result, we'll build a better society sooner rather than later.